And why don't we, let me see. Lauren, who are we going to hear from today?
First, we have retirement, and Ronit Rubin from my office is going to present the overview of the package.
Okay. Give me 1 second. Okay.
Thank
All right.
you.
Policy. Go right ahead.
Thank you. Good afternoon. The proposed fiscal year 2023 budget for retirement and Social Security totals $222.6 million, an increase of $47.9 million, or 27.4% over the fiscal year 2022 budget. The retirement portion of the budget totals $200.5 million and increases by $46.9 million, or 30.6%, primarily due to a $4.4 million increase in the county's annual required contribution, or ARC, to the employees' retirement system, and an additional $50 million contribution above and beyond the ARC to improve the system's funded status by 1%. These increases are offset by a one-time contribution of $7.5 million to the police, fire, and widows pension plan in fiscal year 2022. The Social Security portion of the budget totals $22.1 million and increases by $939,000, or 4.4%, due to an increase in FICA contributions associated with the proposed budget's higher salaries. On page 2, you will see the budget history of the program and the composition of the proposed budget. On page 4, the analysis identifies various fiscal year 2023 budget highlights. And beginning on page 5 are the related topics for discussion, including the county's annual required contribution to the retirement system, the additional $50 million contribution to increase the system's funded status, that there will be a 3% COLA for retirees, the financial condition of the retirement system, and pending legislation, which includes a Plan B backdrop for police and firefighters. With regard to potential budget reductions, Social Security contributions would be reduced to the extent that any reductions are made to salary-related expenses in agency budgets. At this time, I would like to turn it over to Director Blades for discussion.
Good afternoon, Mr. Chairman, members of the council. If I could, real quick, I'd just like to introduce the staff who have helped us with the formulation of the retirement budget, starting with Deputy Director Kevin Reed, Chief of Budget Administration Matt Carpenter, and Ms. Belcastro, if you don't mind, can you pull Robert Burrows in from the attendee list into the participants? And Bob is the Chief of Treasury Management.
Okay.
So starting with question number 1, the beginning is the reasons for the $3.6 million or 4.8% increase for the annual required contribution for the police. 1.5 million of that is due to a 3% growth. That is part of the normal annual growth in amortization costs. 2 million is due to general salary increases. 600,000 is due to normal costs of the annual cost of benefits occurring during the year, plus administrative expenses. and $500,000 is due to experience loss for retirement, separations, et cetera, different than expected. That's a total of $4.6 million. We did have a change in methodology for assumptions in our smoothing methodology from going from 10 years to 5 years, and that was actually a reduction of $1 million, which resulted in a $3.6 million increase for the police department. There's a question on the county's ARC and future ARC increases related to the experience study. An experience study is done every 5 years to review all assumptions that are ultimately used in calculating the ARC. Generally, experience studies can result in either increases or decreases in costs. The biggest driver of cost increases is a reduction in the interest rate for making assumptions as far as the valuation rate. We do not anticipate any interest rate will need to be reduced below our current 6 3/8 valuation rate. There may be some additional mortality improvements added that may increase costs, and there may be additional wage increases that will again increase costs, but we'll get into those as we move forward with updating the experience study this summer. As far as methodology, the next question is as far as the rationale for using projected unit cost versus entry age normal. Both of these are common methodology used in funding and accounting for pension plans, and both are fully acceptable under actuarial standards of practice. The entry age normal values the cost of the pension plan through a level percentage of pay contributions for each employee, while the projected unit credit is an accrual method, which is spread over multiple years and results in slightly lower contributions in the early years and gradually increasing to higher contributions later in an employee's employment. Right now, the ARC is using the entry age normal, which is higher than for the ARC than the projected unit credit, but this will shift over time as each methodology will eventually pay the same dollar amount. It's just the distribution of how that is paid. So the original rationale for using the projected unit credit was to lower our contribution when budgets were much tighter. And the final question is the likelihood of an additional one-time contributions. This is a unique year, we all know. We came in with a very high fund balance. The budget submitted leaves an 18% fund balance. We took advantage of this one-time opportunity to increase the funded status of the plan by contributing an additional $50 million. Future one-time contributions above the ARC will be determined by available funding. And the continued exclusion of the one-time contributions above the ARC from the spending affordability guidelines. So those two will be critical, and we'll see where we land with FY24 and our ability to fund higher than the ARC. And are there any questions on section 1?
Any questions or comments from the members?
So
Go ahead, Director Blades.
thank you, sir. Next question is related to the 3% COLA for retirees effective July 1st. Available funding in the Post-Retirement Increase Fund, or PRIF, determines whether or not ERS members receive a COLA. The PRIF is funded with investment income above what we call the PRIF rate. Prior to this year, the PRIF rate was 7 7/8%. The county actuary advised us that 7% is known as a best practice, or what he called a gold standard. So we, approached the planning board with using 7%, and the board elected to vote for a decrease in that PRIF rate to 7%, as well as changing the methodology for smoothing from 8% or from 8 years to 5 years, and that resulted in sufficient funding going into the PRIF from investment income, which could afford a 3% COLA effective FY23. So after paying out the 3% COLA, the Post-Retirement Increase Fund will have sufficient funds remaining to cover a 1% COLA in FY24 as of this moment. If we continue to do well with our investments and we exceed the 7%, there could be additional funding available to go up to 2 or 3%, but that will be determined at a later date. Any questions on the COLA?
Mr. Chair,
Yes, Councilman Catch?
yes, Ed, when was the last time that retirees did get a COLA?
I believe it's been 10 years since they last received a COLA.
10 years,
There was a
wow,
1% in 2018.
2018 was 1%.
1%, wow. I think my next question is related in some way. I noticed that the number of retirees and the number of active employees, those numbers are getting very close to one another. And we all know when that happens, the cost borne by either the county or the present employees are going to increase. What does the future look like? Will we ever have a time where the number of active employees will be lower than retired employees? We know people are living longer. And I'm just wondering if there's any future prediction on that.
So that's a very good question. And I'm going to turn that over to Mr. Burrows to see if we do have any information on that available at this time.
As the plan matures, I expect the retirees will exceed the amount of active members. And it's getting close now. I believe there's 191 active members and 26 retirees. So as your plan matures, retirees will be exceeding active members at some point in the future.
So we have a situation where the amount of money that the employees put in is set. And I know there's an older retirement system. I call it 55 because that's the denominator. The new one is 70, and then you have the one of 40. Do you know off the cuff what percent of salaries each one of those three categories of retirement pay? The employees pay?
We do have a schedule that we can forward to you. I believe the 40th is 10%.
The 40th is 10% for members hired prior to July 1, 2007, and 10.5 if you were hired after July 1, 2007.
And police and fire and general government employees also have different rates.
That's right.
We went through this on the state level, and it took years to finally get to a point where the system, I'll say, is more solvent than it was when we started. The state made the mistake of when the state was awash in money, they would increase the benefits. And I guess my question is I really don't think that the retirement system were the I would not call that a good system for retired employees at all. You realize after 35 years, you would get just half of the salary. I would like us to take a look at possibly a defined as well as compensation a defined contribution system. You know, you realize also people are on the move. They go from one job to another. And when you have a system where you're simply paying money and the county matches it with some amount, it's much easier to transfer to another job. I can remember when the state of Maryland, the employees were putting in 5%. And the year I left, the state was putting in 25% of the average salary. Ed, do you know what percent does the county contribute to these retirement systems? As far, I don't mean the lump amount, but I mean if you know, let's say somebody paying 10% or somebody paying into the system 5%, what actual percent is the county putting in toward them?
I can answer that. It's 24.4%.
Wow. So the county could actually have a defined contribution system, match it with 20%, and actually save in the long run. People could either keep their present retirement or and then go to a defined compensation, a defined savings program, or stay in the retirement system. So there's a lot of things that we can do as a council, as a county, that will end up benefiting our employees. Because again, I certainly think that 70 system leaves a lot to be desired. Thank you very much.
Thank you, and we're always open to explore other opportunities to benefit county employees. But we also want to make sure that the pension system is there for everyone, that we meet our obligation.
Absolutely.
That's critical.
To guess, put it all in a nutshell, Director Blades, is our pension system secure?
Yes, it is.
And I guess a large part of that is based on, is it fair to look at the number of employees that you pay versus the return on investments that we receive? Which one of those are probably the most important?
I would say the number of people and the employees being paid, the retirees actually receiving the benefit, and making sure that we protect that benefit. But just as important is the return on our investments to make sure we continue to meet our commitments.
Okay. All right.
Mr. Chairman. Mr.
Yes.
Chairman. Yeah, just real
Yes.
briefly, Mr. Blades, we appreciate your work and your team's work. I'm grateful for everything you guys do out there, along with our auditors. And what is our current pension funding status? Is up to date as we know it? What is our percentage pension funding status?
Right now, for funding status, we are at 61.5%. That on an actuarial basis, and 68.4% for a market value basis.
Okay, so if we were doing market value, we're closer to 68.4, you said?
Is the market value, yes, sir.
And a lot of our municipalities around us are more market-based than our rate, right?
Yeah, they have actually, we have a 6 3/8 is our valuation rate that we use to determine our actuarial basis and our market rate. Other jurisdictions use higher rates. I believe the
Like
state is at 6.8%. Other jurisdictions can be as high as 7.5%, which definitely triggers a higher valuation. If we were using 7%, including the additional 50 million that we contributed, we'd be at 66.9% on an actuarial basis, and we'd be at 74.2 as on a market value.
Got it. That's perfect. Thank you. No, I appreciate that. And I know one of our, we've intentionally kept our rainy day fund a little higher too, because that's also good for the credit rating agencies we work with, and really keep in close touch with them to make sure we keep our rating AAA status.
Absolutely.
You have any projections on the funding status over the next 5 to 10 years? How do you see that 61.5% over the next 5 or 10 years? What do you have any crystal ball outlook there?
Not necessarily crystal ball, but actually the next question in the auditor's package gets into some of these investment policies.
Perfect. I'll wait then. I can wait.
Perfect timing, right?
Yeah. No, thank you. I'll wait for the questions, and then we'll go from there.
So the question is discussing the system's financial condition and investment policies, and our actuary has advised us that the financial condition of from an actuarial perspective is improving. The most important factor is the willingness of the county to fund the ARC, the annual contribution, and that continuing to fund the full amount of the annual required contribution will continue to move the system toward full funding or 100% versus our current 61.5%. But based on the actuarial calculations, fully funding, we're talking about 24 years to take for that to happen. And that's just on the ARC, not if we are able to fund in additional funds like we did this year. So, and we've talked about, the board did make some minor revisions to its investment policy to improve risk-adjusted returns. In addition to items listed, the board has broken out private equity mandates into both private equity mandate of 9% and private debt mandate of 5%. The private debt mandate will reduce the fixed income allocation by 5% from 27% to 22% of our portfolio. And private equity and real estate are part of an overall diversified program that have very strong performers. Both have double-digit returns over the 10-year period beginning 2021, with real estate return being 10.5%, private equity return at 14.6%, and private debt return at 8.5%. That said, regarding the county's universal rankings, every plan is unique. And it's not an apples to apples comparison when you're looking at us versus other retirement systems, because we have different targets on rate of return, different asset class targets, different levels of payment benefits. But our plan has returned 8.9% over 10 years, which is well above the 6 3/8 target. I also of note is that our board has a robust emerging manager program that encourages the hiring of minority and women-owned firms. And currently, minority and women-owned firms comprise approximately 17% of our investment fund. So that cover your questions, Councilman Quirk, or anything additional I could help you?
I mean, obviously, 2022 started out pretty rough. I mean, you look at the Barclays U.S. Aggregate Bond Index year to date, down 10.51%, and that's bonds. And then obviously S&P down 13. So it's stock market's looking like it's trying to predict a recession now. The only positive news is the stock markets thought there's been many recessions and predicted recessions, many of which have not come to pass. But clearly, without a doubt, a pretty bumpy start. And obviously, pensions are invested for the long term. Hopefully, our pension consultants watching our duration risk, because bonds are just getting slaughtered. 10-year going up from 1.5% to 3% since January. That's pretty intense. So you got to take the good with the bad. But hopefully, we're being opportunistic now that the markets have priced in recession. If there's no recession, maybe we get a pretty decent bounce coming in toward the end of the year. But I guess time will tell. So it's never dull. That's for sure. Yeah.
That's for sure. I sure hope so. One of the benefits of our system, although see that the 6 3/8 valuation rate works both ways. It makes our funded status look lower, but it means that we don't have to take as much risk as a jurisdiction that say they're doing 7.5%. They have to take more risk than we do. So the offset is worth it, in my opinion. I wouldn't want to increase that 6 3/8 just for the sake of increasing fund balance. I'd rather have a, conservative investment program that benefits our members and where we don't have losses.
Yeah, I definitely agree. And I just think going forward with the Spending Affordability Committee, really working closely with you to make sure that any money that we add to the pension to shore it up, we look at the possible exclusions like, we've been doing, because that's money well spent long term, helps the system, shores up the system. So I know that's something that I'm sure the county council and the auditor's office will work closely with you to make sure we're doing what we can to continue to make improvements in whether it's OPEB or whether it's the pension funding. Those are just two gigantic challenges for the county, and ones we have to really watch closely, because markets aren't always going to be good, and when they're not good, we have PAYGO we could fall back on if we need to, and we have things that we could reach into thanks to your leadership, Ed, and your team's leadership. So I appreciate the way you positioned the county.
Thank you.
Mr.
Thank
Chair,
you,
if I may.
Councilman Quirk. Yes, Councilman Crandall?
Thank you, Mr. Chair. Mr. Blades, I just want to echo what Councilman Quirk has expressed, and he sort of stole my thunder, but he did it a lot more articulately than my skills are able to do. But it does appear that the retirement system is in much better health than it was just a few years ago. And I think, you and your staff and your leadership on stewarding the process and requesting that the council approve additional contributions to the system, I think is probably the best thing that we can be doing right now. And I just, I'm surprised Councilman Quirk used the R word. I try not to use the R word so we don't live into a self-fulfilling prophecy. But to what extent are we, I understand that there are risks in our investments, and that the risks have been mitigated. Can you talk about the risk mitigation strategy that both you and your staff and the board uses to make sure that we're not overexposed in the more risky areas of the markets?
Sure. I'm actually going to turn that over to Bob, because Bob lives it every day.
Yeah, thanks, Ed. It's been tough lately. The fact that we are well diversified assists us. And for example, in fixed income, last year or 2 years ago, the county moved about 4% of its fixed income into a low duration to avoid some of the risk. We've also had about 3% in bank loans, and we also added a TIPS allocation of 3% to the fund. So all three of those items are keeping the fixed income from falling as fast as the aggregate bond index. I believe there's other diversification tools that we're using. We have an all-weather fund. We have real estate, which we've just increased to about a 7% allocation, which has done well with inflation lately. And we have cut back a bit on emerging markets from 7% to 5%. Adding the private debt is another way that private equity and private debt is another way that you can add returns, increase your return. But overall, I think we're well positioned because we have 60 some managers across several asset classes. So it is a tough time now. There's no doubt about it. But I believe in the long run, the county will come out ahead.
Okay, very
Mr.
good.
Chairman?
You mentioned something that I didn't, I'm not sure I know what the acronym. It was TIPS.
TIPS, that's inflation protection bonds.
Okay,
Treasury inflation protection bond. So as the inflation goes up, the value doesn't fall as fast as when bond rates go up. It wouldn't fall as fast as a traditional
so
bond.
sort of like a hedge.
Yes. Also, we've pushed more into value away from growth recently as well. We're doing a value index for 2% of the moving. We have 17% in the index, U.S. index, and we're moving 2% more towards value, and then another 20 million to a value manager. So the consultant is aware of what's going on. They're making a few changes, tweaking the portfolio to the current environment. They do an overall review every year, and this is a result of their review this year.
Very excellent. Thank you, Mr. Burrows.
You're welcome.
Yes,
Chairman?
yes, Councilman Quirk.
Yeah, just curious. Do we have any exposure at all with Russia? And what's our exposure with China, since they seem to, launch a battle against capitalism in June of 2021? So do we have much exposure, if at all, to Russia? And do we have much exposure into China?
Russia was a minimal exposure. It was like the 0.5%. But I don't know how much exposure we have to China, but cutting back emerging markets would reduce our exposure to China. So I don't have the exact number for you in those. But emerging markets includes a lot of other places besides China.
And how are we doing year to date? Do you have the number by chance year to date? I know, 60-40 portfolios, a lot of them are down
I know
10, 12, 13% year to date. How are we looking?
I have through the first quarter. I have to open that up, but they had just given that to us the other day. So let me take a look there. I know we're in the 36th percentile, and let me see how we're doing year to date. Yep, just a minute. Through the first quarter, that was only 3 months, January, February, March, we were down 4%.
Do you have anything real time? Do you have anything up through May 8th by chance?
I don't. I can get that for you though, and I asked the consultant for that.
I'd be curious.
It won't be that pretty though. It really won't.
Yeah, no. I'm looking at some of these retirement funds. Down 12% year to date. S&P down basically 15 after today. Nasdaq down 25. So definitely raining a little bit, and it definitely puts the long term into long term investing. That's for sure. But yeah, and value. Obviously value's been a better place to shelter, but obviously we don't want to put everything in any one place. And but yeah. Well, let's see what happens. Hopefully we avoid recession, and if we do, then we'll see a nice recovery toward the end of the year. But only time will tell. Thank you.
Mr. Chairman,
Yes, Councilman Cash.
yes, I would like to see our retirement system pull all investments that we have in Russia and China. I just don't want to, I just think it's wrong for us to be helping both of those countries financially. And I would ask that the board, as soon as possible, come up with a strategy so that we can withdraw our investments in both of those countries.
The investments in Russia are not liquid right now, so but they are very small. But there is no way to get any of those funds out, or the managers would have immediately.
We looked, as soon as the Russians invaded the Ukraine, we looked to pull out all investments, and under current guidelines, we can't. It's not liquid, and we can't get to them. But as Bob said, it is very de minimis in nature as far as what we have invested there.
In China, what is?
And Russia, we have to pull China.
Say that again. You did pull China.
We looked at Russia. We have to pull together the information for China.
Please do. I just
Sure.
think that it doesn't make any sense to invest in countries that are not our friends. I'm sure we don't have anything in Iran or countries like that. Would that be true?
We'll have to ask our consultant to break that out
Yeah,
for
we
us.
would.
I think the state has divested in investments with firms that do business uh, with Iran and with, I'm not sure about Russia, but I think you were in the legislature, Councilman Catch, when there was divestment acts for businesses. They couldn't get state contracts if they did business with Iran.
That's basically why I've asked the question.
Yes, I assume that.
And I just think, with what's going on in the world, I don't think it makes any sense for the Baltimore County government to assist any of the countries who are unfortunately our enemies. And, you heard the Putin state that Russia was at war with the US. I mean, that's very disturbing to hear something like that, and we should not be in any way supporting them. So, thank you.
Thank you, Councilman Cash.
So, Mr. Chairman, we have two more questions if you want me to keep moving forward.
Please.
Question number 4 involves legislation that we've submitted that'll be voted on June 6th. There will be a work session on that bill, but just a high level to talk about a couple of things there. One of the pieces of the bill is to require mandatory participation in the retirement system. We currently do that with police and fire sworn personnel. They automatically have to enroll in our retirement system when they're employed with the county. For whatever reason, the law allows other county employees 60 days to make a decision. And what we find is that many employees, for whatever reason, may not join. It may be that they forgot to do the paperwork, that they don't think they're going to be with the county very long, or whatever other reason. And then years later, they come to realize they've been with the county for a long time and they're not part of the retirement system. So making this a requirement is to the benefit of the employee. If they vest, that's great. They're going to have a pension. If they leave before their vesting, they'll get their money back with 5% interest, and they can roll that into a deferred comp or a traditional IRA and still have that money toward a retirement strategy for themselves.
Well, I can tell you, Director Blades, I've been advocating for that for some time, and I certainly support that 150%. Because you have these scenarios where I think you described it very well. For whatever reason, and I'll add a few other reasons, people being ill-informed or uninformed or just not knowing, were sleeping on the date, or at one point I know there was some confusion. One paper said 60 days, the website was saying more time, like 90 days or 100 and some days. And it was very confusing to the employees, and it causes some problems. And coming from a fire department system, you get hired, you sit down, you sign up, that's the end of it. There's no matter what it is, if I said to somebody, I'm going to give you $1 million, but the choice is up to you, sign this form. Some people are going to be skeptical. They're going to think, well, wait a minute, there's no free lunches. Wait a minute. But I guess asking that simple question and giving somebody a choice, you're going to get a percentage of the people that's not going to take it. They're going to think something's wrong. They're not sure, and they're going to sleep on it. So I think that's very important that we do that for our employees. And the idea of giving them a choice in and of itself causes some of them to retract. And then and the other problem, which is something that I also want to advocate, I've been advocating for, is for these employees who made that decision. The problem that I have is you make a decision today and you're stuck with it forever. Forever. You can never come back. We got a right to rescission in the state of Maryland, like 3 days on a contract. Here, they make a decision, and for the next 20 years, they're stuck with what they did. And I just think there has to be some way that we can fix that. Maybe not 20 years, maybe that's too long, but clearly within 5 years, we should be able to come up with a fix where the employees can buy their time. We can work something out and put them on a path to getting a pension when they realize they made an error. Any additional questions or comments? All right, Director Blades.
Okay,
Do you have another one?
Sure. There's also some questions regarding the backdrops that are in the bill. I'm sure we'll go into that in greater detail at the work session, but they are designed to be cost neutral for the county, with police and fire sworn picking up a greater percentage as far as their contribution. And then the question is on Council Bill 17-22, which was passed by the council, that requires our actuary to set up a model for projections for salary increases and what that does to the pension system. And the most difficult part is taking place right now, which is the initial setup of the methodology for creating the projections, which our actuary advised he is moving forward with. We gave him the information as soon as the bill was passed. So we hope to have that. He advised that it's nearly complete, and we should have the information shortly. And I do fully expect to have all that information available at the work session. And the final question is regarding the county efficiency review. This was done by Public Works LLC, and one of their recommendations was to move benefits and retirement under OHR from OBF. Not every single recommendation made by Public Works LLC will be implemented. At this point, we are not moving forward with that. That is not part of the FY23 budget request. We will have things that we will continue to review as far as whether or not they're in the best interest of the county, but at this time, we are not moving forward with that recommendation.
Thank you
That's
very
all I
much.
have.
Clear cut. Any additional questions or comments from any of the members or our auditor staff?
But Mr. Chairman, I just want to say that Ed Blades grew up in the 3rd district, was educated in the public schools in the 3rd district. And there's, everyone's complimenting him because he does a great job. So I just wanted to bring that out to all of you. Hereford High School.
That's right. Thank you.
You're welcome.
Thank you, Councilman Catch. We are certainly very appreciative and very fortunate to have Director Blades and his staff. They do a fantastic job, and I sleep very good at night knowing that Director Blades and staff are looking out for the county finances as well as the pension system for our employees, making sure that we continue to be solvent and solid. And I'm happy to hear you give such a resounding vote of confidence for our public schools, Councilman Catch. I share your praise for our school system.
And Mr. Chairman?
Yes.
Yeah, and I just couldn't resist but to echo the comments. And, I think Ed Blades' team has a really tough job, because I think the misconception often out there is the county has unlimited money, unlimited resources. And clearly, the federal government helped big time because of the pandemic. So that definitely helped us a ton. But saying that, there is unlimited demand on every dollar that we have. And I mean unlimited, whether it's for capital projects, like our schools or our public infrastructure, whether it's for many of our deserving unions and representatives out there, our public workers. But at the end of the day, you can only stretch a dollar so far. And how do you prioritize that with millions of different requests that come in constantly? That's a tough job to do. But I also did want to recognize our audit staff as well, and also the transparency between the budget office and the audit office is maybe, I don't know, 1 million times better than what it used to be, because what it used to be was very difficult. And so I did want to acknowledge the county exec's leadership there, and Director Blades for really trying to work closely with Lauren and Liz and their team. And we'll just keep doing the best we can, given the challenging times. I mean, we've been in the pandemic and the tax increases, which weren't easy, and really trying to weather this unusual storm now, given what's going on out there with China and the war in Ukraine. So stay tuned. But yeah, job well done, Mr. Blades and your team and the audit staff. Thank you, Mr. Chairman.
Thank you.
Thank you, Councilman Catch. I agree 100%. Any additional questions or comments from the members?
Yes, Mr. Chair. Just
Yes.
want to also echo the comments about the great job Mr. Blades has done, and also the audit staff. And to Councilman Catch's point, I just wonder what heights Mr. Blades might have reached had he grown up in the 2nd district.
Oh, not
Those.
like he has now, that's for sure. Our
Thank you,
schools
Mr.
are
Chair.
superior in the 3rd district.
Well, let me just add that, the county executive, as well as many others, including myself and many members here in the council, we have worked very, very hard to make sure that every student in Baltimore County receives the very best education they can, and that your education is not determined by the zip code or the district in which you live. We have done a great job of dispersing resources. I understand that our friends like to brag about their districts an awful lot, but it should be noted that we want to make sure that every child in Baltimore County reaches his or her fullest potential, regardless of where they live. Now, Councilman Catch, that said, you and Councilman Patoka can go right ahead. I've already put the disclaimer out there.
I just want
You
you
go
all
right
to
ahead,
know
keep on
that
bragging.
my 40 years in the state legislature, I bragged about my district all the time. And, so, when you feel that way, why not? And,
Why not?
Why not?
Absolutely. Okay, any additional questions or comments? All right. Well, we thank you so much. And I guess we're actually ahead of schedule. I think we're prepared to keep going. And we're 5 minutes ahead of schedule, so why don't we go right into health? Is Dr. Branch here?
Dr. Branch is here,
The doctor is in the house.
is in the house.
Or in the library, according to your pictures.
There
That's
you
okay.
go.
There's a library in the house.
There you go.
Let's move. Let me get my things together. Lauren.
All right, I have Zachary Ament from my office to give the overview for the health department.
Okay, Zach, take it away.
The proposed FY 2023 budget for the Department of Health totals $192.9 million. As you can see on page 1 of the analysis, the general fund portion of the budget totals $26.6 million and increases by $753,000 or 2.9%, primarily due to increased personnel expenses from mid-year FY 2022 mid-year additions, as well as COLAs and increments in longevity. The special fund portion of the budget total is $166.3 million, increases by $61.9 million or 59.3% due to a new $59 million abatement of harms from the opioid epidemic grant. This funding is related to the recent settlement of opioid litigation and was approved by the General Assembly this past session. On page 2, the pie charts show how the proposed funding will be allocated across programs and expenditures. Continuing grants within the special fund represent the largest type of allocation, while grants, subsidies, and contributions and personnel expenses represent the largest type of departmental expenditure. On page 3, the exhibit identifies a significant increase and decreases from FY 2022 to FY 2023 for the general and special funds. On page 4, The analysis states that this year's review process does not identify any specific areas of reduction and makes notes of an area within the budget that supports flexibility in terms of the hiring process. Other topics for discussion, which begin on page 4, include personnel, the opioid epidemic, continuing impact of COVID-19, crisis services, and capital projects. At this time, I'd like to turn over for discussion.
Okay. Dr. Branch,
Well, good
any
afternoon.
questions or comments from any of the members
Oh.
before we go into the discussion? Okay, Dr. Branch.
Well, good afternoon, Chairman Jones and all the distinguished council members. I want to thank you for the opportunity to come before you today on behalf of the over 850,000 Baltimore County residents who depend on us. Believe it or not, I look forward to coming before you during this time each year. And that's mainly because I'm always extremely proud of the work that we do in HHS on behalf of your constituents. We do this work so well at times that the positive impact it has on our residents can easily go unnoticed. For example, because we have already gone to the restaurants and ensured that they're operating safely, patrons don't have to think about whether it's okay for them to eat there. And as the summer fast approaches, the pool goers and the beach enthusiasts can safely enjoy those environments because our inspectors have already visited these sites ahead of them. In fact, we've been to the nursing homes, the hospitals, grocery stores, the food markets, food trucks, and the food establishments at festivals. Baltimore County Council, I am proud to say that HHS is on the job. Today, I have with me some of my HHS leadership, and I'd like to introduce them. Della Leister, who's the Deputy Health Officer. She should be on the call. Mark Milsper, the Deputy Director of Social Services, should be on the call. And Lawrence Richardson, the Deputy Director of Finance and Administration, should be on the call. This team and their staff are HHS. And ladies and gentlemen, HHS is on the job. And if I was there in person, I would say, let's give them a hand clap. So I'm just going to kind of do one of these numbers like this to my staff and say, wonderful job, guys. So at the last budget hearing, I shared with you a tale of two pandemics, COVID-19 and opioids. Now we're in a much better place on the COVID front now. The number of COVID cases have decreased, hospitalizations are down, and more importantly, the number of COVID-related deaths are down. That's wonderful news. But make no mistake, we are not out of the woods yet. We are not out of the woods yet. In fact, in the past 2 weeks, we are seeing the variants causing an uptick in the numbers of positive cases and outbreaks. Now, fortunately, the severity of these positive cases is not what it was previous. We are continuing to watch the trends so that we can respond accordingly moving forward. We continue to encourage, and as the health officer, I continue to encourage full vaccination against the virus, which includes getting the booster when eligible and the second booster when indicated. And while the current variants are highly transmissible and very contagious, it seems that individuals who are fully vaccinated and contracted the virus are far less likely to be hospitalized or die from disease. I say that to you with a personal experience recently. In the past 2 weeks, my brother, his wife, his 85-year-old mother-in-law, and my 85-year-old mother all came down with COVID. And we were extraordinarily nervous about all that. But I can say here to you today that all of them did extraordinarily well with only minor symptoms. And I believe that that was due to the fact that they were all vaccinated and boosted. So I say to you, and I share that personal account with you, to say that I think that the vaccines clearly is a matter of life and death. So as we go through all of this and we continue on with our plans, we will continue to adhere to the World Health Organization, the Centers for Disease Control and Prevention, and the Maryland Department of Health guidance in addressing these case trends. Now, we expect about in June or so approval for the vaccine for children under the age of 5. Now, we've been working with the pediatricians in our area, in our jurisdiction, to be ready to vaccinate that population. In addition, we plan to utilize our health centers and our WIC centers as vaccination sites for this youngest population. And we're going to also continue to provide testing at our health centers, and we're going to offer homebound vaccinations, and we're going to aggressively ramp up our mobile operations outreach vaccine clinics, which we call our MOVE clinics. Additional space is needed to efficiently provide ongoing testing services at our health centers. And towards that end, I am so happy that the administration has included funding to purchase a permanent trailer for our Dundalk Health Center. So in an effort to support and promote our MOVE clinics, we are maintaining our COVID hotline and our COVID email information response efforts. So I've told the council many times before, we are running a marathon and not a sprint. But I most often am referring to the COVID pandemic when I make that analogy. But today, I want to go on record as saying that that analogy also applies not only to COVID, but also to our opioid crisis. Unfortunately, as it relates to opioids, I must inform you that Baltimore County residents continue to struggle with substance use disorder, and too many families continue to be impacted by the opioid-related fatalities. Now, we are excited about the potential opportunities in the $59 million abatement of harm from opioid settlements that will bring. And that's why we signed on to the lawsuit. And the department has already and will continue to leverage state and federal funding. So we're also implementing a hub and spoke pilot program to create a network of providers working together to provide treatment tailored to individuals. Now, our spoke providers are office-based providers like primary care providers, internists, OBGYNs, who offer the opioid use disorder treatment with the buprenorphine or the naltrexone medications. And now these providers can offer treatment and setting with very few restrictions for patients who required limited additional services. Now, our hub providers are specialty addiction providers. They offer more intensive services for individuals with more acute needs. And I can tell you this hub and spoke for us in Baltimore County is starting to really work and take off. I was just at a conference last week at Johns Hopkins and facilitated 2 primary care providers to join our hub and spoke model. So the word is getting out there with the providers, and I think that as time goes on, we will have a very successful program. Unfortunately, also, we're seeing a continual increase in our mental health needs and recognizing this as a team effort. It takes a team to deal with this mental health needs. So we require a team approach. And we've been working with both the police and also 911 to expand our crisis response. And we have increased the number of crisis response teams and have placed a licensed clinical professional in the 911 call center to better triage and respond to calls for help. And the mobile crisis teams have increased from 6 teams to 8 teams. And the additional 2 teams were fully up and running as of February 14th, 2022. So, in closing, I would be remiss if I did not thank the administration for their continued support. I want to take this opportunity to thank the county executive for his vision, Madam CAO Rogers for her leadership, and each of you for your partnership in protecting the public during these most unprecedented times. That support has enabled us to combat COVID while continuing to deliver all the other vital services the Department of Health provides. Did I mention to you that HHS is on the job? Well, we're on the job. And I'm just going to go out on a limb right now and say for the record, believe it or not, that I agree with the auditors that there should be no cuts to the health department's budget. Thank you guys for your time and your attention. Back to you, Mr. Chairman.
Thank you, Dr. Branch. I was just curious of one thing. Is HHS on the job?
HHS is surely on the job.
Okay, I'm sorry.
Okay.
I had missed that.
Mr. Chair,
Yes, go ahead, Councilman Katz.
Dr. Branch, have you read all those books?
I've read most of those.
Oh, are they medical books or what?
No, they're not medical books. The last one I read was Trevor Noah, Born a Crime.
Okay. I appreciate the job you do and your agency. We all do. Couple things that I wanted to ask you. First of all, about the avian or bird flu in Canada. Have we had any indication that it's hit Maryland and our chicken industry? And secondly, I read in the audit report, and I don't know if it's because of the additional money from the state or federal government, that you're going to have 600 vacancies in the department. Is that because of the new money, or are you having a problem attracting people to work in your agency?
Okay, so I'm gonna take the second one first. We do not have 600 vacancies at
Okay.
all. And that, yes, across Maryland and across the United States, it is very difficult to hire in certain positions. And those positions for us in the Department of Health are doctors, nurses, and social workers.
Okay.
And obviously not for us, but another area is teachers, right? So for us at this point now, we're trying to continue to hire those folks. And we just work on it, put the feelers out, and hopefully we're going to get people who are going to be coming to us. But those are the three types of positions that are just hard for everybody to actually do. We're going to have some issues in the future also. And the reason why is because when you look at the enrollment into the medical schools and the enrollment into the nursing schools and the enrollment into the social worker schools, it is down. So hopefully we're going to see a turn in that in an uptick. But at this point now, that area is going to be a little difficult. As it relates to the avian bird flu, we are always doing surveillance on that. At this particular time, we don't have any indication that they have major issues in the state of Maryland, but there's always surveillance as it relates to that. And if we have anything going on with that, we would obviously let you know.
The figure of 600 vacancies that I read, I imagine they're not really vacancies. A lot of it is probably the new jobs created with the
That's the number of authorized positions for the
Okay.
entire department.
Gotcha. Oh, that's all of them.
Right, so that's why I was thinking to myself that you guys were increasing my staff by doubling them, and I was kind of getting a little excited there for a moment,
Yeah.
but I knew we didn't have 600 vacancies.
I apologize. I misread it. Yeah, I know we're lacking teachers, policemen, et cetera. And I'm thinking, oh my God, what a huge problem in your department. I'm glad it doesn't exist. Are we competitive?
I think at this point now we are competitive. One of the
Good.
nice things at this time, working with the administration, is that if we have an issue that we're not competitive, the administration is very, very responsive to that. And so when we speak to our Madam CAO, she assists and helps with that. So I think we're going to be fine with that.
Did your 85-year-old mother and was it your brother or sister's 85-year-old mother-in-law?
It was
Did
my
they have-
brother's mother-in-law, my brother's wife, my brother, and my mother all came down. My mom was staying with them, and they all came down with COVID at the same time.
Did the older women have the fourth shot?
Yes.
They did.
hmm
Okay.
They
And
all, but I just want to let you know that both older women have some major medical issues. However, symptomatically, they only had a mild cold flu. They did not have to go to the hospital or anything like that at all. And so that was a blessing.
are they in Maryland or
No, New York.
New York? Now we
I'm
have,
from Brooklyn.
okay, okay. I don't know Brooklyn. So Baltimore County has the fourth shot available for which age group?
So for when it's appropriate, it's usually 50 and older and or with chronic diseases.
Okay, thank you.
Thank you, Councilman Catch. Any additional questions or comments?
Yes, Mr. Chair.
Great, Councilman Patoka.
Thank you. Thank you, Dr. Branch, and thank you for the great work that you and your team are doing. Question about the battling the opioid crisis. What's the relationship and the roles between your agency and the opioid coordinator in the county executive's office?
So the opioid coordinator in the county executive office really assists and is able to globally look at the pandemic from the perspective of all the different departments. So we cannot fight this battle alone only in health. So we've got to look at it from a health department's perspective, social services perspective, a police perspective, fire, the whole works. And we have to look at it from a state perspective and all of those hub and spoke, all of those different providers and partnerships. And that person is the person who coordinates all of that for Baltimore County. So it's really a good, I call it that czar position, so that the left hand can know what the right hand is doing. When you're working hard on an issue like opioids, you can get so entrenched in what you're doing that you don't even know what someone else is doing. And that position allows everyone to be able to share so that we'll know what's going on within our jurisdiction.
Okay, thank you very much, Dr. Branch.
Councilman Patoka?
Yes.
Yeah, I attend many of the meetings of the opioid czar. I don't know whatever you want to call him, and they're held on once a month on Friday. I believe it's 8:30 in the morning if you get up that early. But it's well worth attending the meeting, and you can see the efforts being made to coordinate between private groups that help those with opioid problems and coordinating with HA. You will understand by being at the meeting what happens, and that, you know, this coordination is very helpful to those in our county who are suffering from this addiction.
Sure. Thank you, Councilman Katz, and thank you, Dr. Branch. I understand the concept. It sounds similar. I used to head up one of the governor's coordinating offices. And you may recall, Councilman Katz, like the governor's office for children or the governor's office for crime control and prevention, where there's subsets of the governor's office that work across agency lines so that everybody's working in a coordinated fashion. And it sounds like a similar concept.
Yes.
And the head of that office is a former student of mine, so you know that individual is excellent.
And I just wonder what heights that individual might have reached had he grown up in the second council. I'm just kidding. Just,
Well, he grew up in the fifth
just a joke.
council district, which I know is, and nevertheless, sorry, Councilman Marks, but no, seriously, he wasn't much of a math student, but you know, but as far as other subjects, he was fine.
Glad to know people can succeed.
Yeah.
Thanks, everybody.
Not
Fifth
teachers.
district.
The fifth district produces many outstanding students.
Yeah. So, let's see, any additional questions or comments? I have a few things to say to you, Dr. Branch, but I'm gonna, as always, give my colleagues the first shot. Any additional
Chairman.
questions or comments?
Mr. Chairman,
Yes, Councilman Quirk.
just really briefly, Dr. Branch, as I'm sure, I'm not going to steal Chairman Jones' thunder, but I tell you, during the height of the COVID storm, I thought you and your office were exceptional. And I went in to get my boosters, and I was amazed at how quick the turnaround was and how efficient everything ran. And it was like a well-run, oiled machine. So I was impressed. I had many constituents tell me how impressed they were with the county as well, and so that was great to see. You know, obviously we know like places like the city of Philadelphia, they're doing like indoor masking now, and you know, I mean, I was talking to, you know, as you've experienced and have articulated, I was talking to a friend of mine who just got back from a business trip, 150 people, and he said that now almost all of them are testing positive because somebody had it. So clearly, unfortunately, we're not through this COVID storm yet. Hopefully the positivity rates won't, it seems like the positivity rates will be a lot less than Omicron. But any view on kind of what you're seeing out there in the county, or our numbers, I mean, still fairly okay, and just kind of get your thoughts on kind of what we're seeing around us at the moment in time. Thank you.
Our numbers are upticking at this particular time. You got to remember that the numbers don't mean the same thing as they used to when we look at the number of cases. Historically, when we look at the number of cases, it was because everybody was being tested and all that information was going to the state. Now, probably most people are testing themselves at home and none of that information is going to the state. But based on the information that is going to the state, there is an uptick in some numbers. But what I want you to really look at, and we're going to continue to watch very closely, is the number of hospitalizations and the number of deaths. That's the numbers we're going to look for. And we're going to look specifically at the number of hospitals and number of hospitalizations and deaths of the people who have been fully vaccinated. Because if you're not vaccinated and you are in the hospital, you could have been vaccinated. But if you have been fully vaccinated and fully boosted, and then you are now in the hospital and or you have died from it, that's the number that I'm looking for. Because that's what's going to make us determine if we need to do something or not.
Right. I appreciate that, Dr. Branch, and I know you're probably pretty tuned in with what other experts are saying and thinking. I know Bill Gates recently had some comments about you know, public schools and, you know, should public schools have been shut down or not. I think there's some people really rethinking that, and then of course with China's policy of shutting down everything, well, that's just a recipe for depression and disaster. So that's something we know doesn't work. So trying to balance all these things I think is important, but I feel like we're in very good hands with you and our leadership. And I appreciate your work, and also all the presidents of our local hospitals. I know they've been a great advisory board to you, and we've got a lot of good feedback from them as well. And so, good luck in navigating the next 6-12 months. Hopefully this newest variant won't be as rough. It seems like Omicron was a lot rougher, but time will tell. But we'll weather the storms. But I think we definitely, my message is definitely have to be careful about our public schools. I think the really harm to kids, the mental, a lot of the really tough mental challenges from not being in schools, and also the school work that's been missing. So I definitely want to just guard against that, and then obviously shutting down everything like we did in the beginning of the pandemic, not us, but the whole country. That's just Great Depression times 10. So no, appreciate your work, and I definitely appreciate your leadership and your genuine partnership, obviously with the county council, with the county exec, and with the citizens of Baltimore County. So thank you very much.
Thank you, Councilman Quirk. Any additional questions or comments? Councilman
Mr.
Marks.
Chair. Oh, okay.
Go ahead, Councilman Crandall.
Okay, well, thank you, Councilman. Dr. Branch, thank you for everything that you've done in a very challenging last couple of years. I want to jump to page 6. The opioid issue is something you and I have talked at length about, and I appreciate our discussions through the years, both public and private. So I'm curious about the abatement of harms from the opioid epidemic settlement money that is coming our way, and wanted to know if you wanted to comment on the last sentence there in that paragraph. So there's currently not a grant agreement, so we're not quite sure the parameters used to guide the county on how those funds can be used. We just don't have that information yet, or?
Exactly. We don't have that information yet.
Okay. Do we have an idea?
We don't.
Okay. Any idea of when the state will, do they have a deadline? Are they coming up with?
I have gotten no information regarding a particular date or a deadline or anything like that at all. Basically, it's going to be some money that will be coming to the county. The specifics of all of that has not been worked out, or they have not informed us yet.
Okay.
And I will tell you, as soon as we get that money, and as soon as we get the rules as to what we can spend it on, we will have an absolute plan.
Okay, great. Because well, that grant would come before the council to approve, I assume.
All the stuff comes before the council.
Right. Okay. I was just curious. So it's a large pot of money. So we know we're getting it. We just don't know
That's
how
right.
we can use it yet.
Exactly.
Okay, fair enough. Thank you.
Liz?
This is the appropriation, though, of the funds. So this is the coming of the grant to the council through this budget process.
Okay, so Liz, what you're saying is this would not come before the council as a separate legislative item in the future?
This is the budget process. So it would not, instead of coming through as a supplemental, it's coming through as part of the actual budget.
Okay.
Let me be very clear about something, Mr. Councilman. When we get $59 million from anywhere, the council will definitely know how we're going to be spending that. So I will clearly inform you of exactly what's going on with that. That's not a problem at all.
Very good. I appreciate that.
Yeah.
Okay. Thank you, Mr. Chair. Thank you, Dr. Branch.
Thank you, Councilman Crandall, and thank you, Liz. And next we'll have Councilman Marks.
Yeah, thank you very much. I want to echo the comments of all of my colleagues about your office's responsiveness. As you know, we recently got a question from one of my constituents about vaping. And Dr. Branch, can you just talk about what the county is doing to educate others about the dangers of vaping, and particularly what we're doing to intervene as more and more young people turn to this addiction. Thank you.
So what happens overall is we do have our tobacco program where we have our sting operation so that merchants are not selling to underaged, and we are going to actually be restarting that up post-COVID, and that's going to actually start, if I'm not mistaken, within the next 3 weeks. We'll be starting that back up again. We always have a marketing plan as it relates to trying to get the kids not to do that, and we work very closely with the schools in education in trying to do that. So it's a battle. It's a major battle because obviously the producers of that and the makers of those vaping products are always pushing it out, and they are actually promoting it to the young people. Unfortunately, I'm looking at a lot of my journal literature and things like that, and really seeing a lot of the complications of people who are going into the hospitals having really bad lung disease secondary to the amount of vaping that they're doing. And these are young folks who are under the age of 25. So it's very, very important. We try to get the information out there. We work with the school systems. We're doing the the sting operations, and so we're doing as much as we can to be able to kind of stop the kids from vaping. But I'm going to tell you, it's an uphill battle as it relates to the makers and the producers of that.
Yeah, absolutely. Thank you very much.
Mhm.
Well, I tell you, Dr. Branch, on that note, I'm always curious about when I hear people talk about vaping and how it enabled them to quit smoking. But I think it should be easy for us to, I guess, pass regulation or laws in terms of prohibiting young people from vaping. I mean, I can sort of kind of get it when an older person says I've been smoking for a long time and this has helped me, but young people should be doing neither. And I think that's really clear. Any comment on that before I move on?
Well, I think exactly right. One of the issues that we have with vaping is just like it was when it came to cigarette smoking in the 50s and 60s, right? Everyone was saying it's really not harmful, and everyone is doing it. And even doctors had recommended that a pregnant woman should smoke a cigarette to calm her nerves at that time, right? What we recognize and understand at this point now, we cannot let the folks who are producing this stuff and making this stuff dupe us into believing that there's reasons why we should have it. And quite frankly, the whole concept, I have not seen any literature that really would convince me that vaping is actually helping people to quit smoking. So that's another misnomer that's really out there. Quite frankly, there are other ways that you can actually quit smoking that are much more health conscious. So I say you're right on target when it comes to that stuff. The fact of that is we should not be doing it, and definitely we should prevent our young people from doing it.
Okay, and I guess to sum up, I agree with what Councilman Quirk and others have said. Dr. Branch, you and your team, especially yourself, are truly stars and heroes. You have demonstrated a level of, what can I say, a level of proficiency in terms of mobilizing our resources. And a big shout out to the administration for giving you all the resources that you needed at that time. But when you were managing the distribution of vaccines or the testing, I would tell you that so many times people were not just satisfied or pleasantly surprised, but their experience fell into what I call the wow category, where you did it in such a way that they were wowed. They walked away not just expecting efficiencies, but they walked away like, wow, I went in and I was out in, a half an hour, or there was no waiting and I can't believe it. I came with books and newspapers and all these things thinking I was going to be there all day, and you were very efficient from the very start. So I appreciate that. And I think we all are very grateful for your service. And I will also say that a lot of the healthcare facilities, the nursing homes, and others had a similar experience in terms of a wow experience when they would talk to me and I would ask them, is there anything else the county can do to help you? And they would just talk about all the support they receive from your department and the updates and everything else. And they would reply, no, it's nothing more they could ask for because you guys were so good to them. So I certainly appreciate that very much. And I guess I want to give you a shout out. And as always, you continue to do all the things that, that doesn't grab the headlines, but your office is there doing the work day in and day out. So now I'm going to comment on your latest book, which I had not heard of that book. But I took a quick read of at least one paragraph. And it says, this talks about Trevor Noah. I take it he's from South Africa, because that's what the book is about, South Africa. And he coins it apartheid as opposed to apartheid. And he says, you separate people into groups, you make them hate one another, and you can run them all. And I thought that was very interesting because the thing that I thought about is Lyndon Baines Johnson. Lyndon Baines Johnson said a similar thing. He said, if you convince the lowest white man he's better than the best colored man, he won't notice you're picking his pocket. Hell, give him somebody to look down on and he'll empty his pockets for you. I think, these are some very, very truthful statements that should be a lesson for all of us. But I guess in humankind, I guess we have I pray that someday we are on the path to getting a lot better, but I pray that we get there sooner than later. But I thank you for all you're doing, and please fill me in on the rest of the book, because I'm too busy reading budget books and all sorts of other things. I don't have time for a lot of reading other than this technical stuff. Any additional questions or comments from the members? Thank you very much, Dr. Branch. You and your staff continue to do a great job, and we appreciate it very much.
God bless you all.
Thank you, sir. God bless you as well. And now, since we are right on schedule for the most part, I guess we'll move right along to our favorite subject, elections.
And from my office, I have Kim Bauer-Weeks, who will give the overview for elections.
All right, Ms. Weeks.
The proposed FY 2023 budget for the Board of Elections totals $9.5 million. As you can see on page 1 of the analysis, the budget is comprised solely of general funds and increases by $3.2 million, or 51%. The increase is due primarily to costs for the 2022 primary election, which are rebudgeted in FY 2023 because of the Maryland Court of Appeals ruling to change the date of the primary from June 28th, 2022, which falls in FY 22, to July 19th, 2022, which falls in FY 2023. Additionally, there are some increased costs for state shared expenses, including call center support costs, which contribute to the budget increase. On page 2, the pie chart shows how the proposed funding is allocated across types of expenditures. State shared election related costs represents the largest area of expense. On page 3, the exhibit identifies the significant increases and decreases from FY 2022 to FY 2023 to the general fund. Also on page 3, the analysis notes no identified potential budget reductions. Topics for discussion, which begin on page 3, include gubernatorial primary and general elections, personnel, and the relocation of the Board of Elections office and warehouse space. At this time, I would like to turn it over for discussion. Thank you very much.
Thank you very much. And next we will hear from Director Lavoie. Lavoie?
Yes, sir. Good afternoon, Chairman Jones and council members. Thank you for allowing me the opportunity to come before you today. First, I am very pleased to report that Baltimore County Election Office has completed the entire redistricting process. It's normally a 6 to 8 month process, and we were able to complete it in less than 4 weeks. I want to extend my sincere appreciation to the County OIT GIS team for their assistance. They, along with us, worked long hours to complete the meticulous process of reviewing over 800,000 addresses in Baltimore County. The State Board website and the voter lookup services will not be active until all 24 state jurisdictions have completed the process, which hopefully will be soon, within the next week or so. But as of now, Baltimore County, I have available for the council members and the other candidates voter lists for our districts if they're now available. So with the redistricting process, we now will have 243 precincts, which is an increase from the 236 that we've had before. The Board of Elections is holding a special meeting this Wednesday, the 11th at 11 a.m., at which time they're going to adopt the resolution designated the new precincts and the actual polling place lists. Again, the voter lists and the polling place lists, all of that right now is unofficial until the board holds their meeting this Wednesday at 11:30. On election day, all 243 precincts will be open. I am currently finalizing the equipment deployment and election judge needs to coincide with the new voter turnout, the voter numbers for each precinct. And we're facing some obstacles in hiring election judges due to the primary election date change, specifically Republican voters to serve at our polling places. However, we've started very aggressive efforts to that end. We've sent out recruitment interest letters and flyers to Republican voters in certain districts where we have the greatest need. And I'm confident that we will be able to meet the goal and staff our polling places correctly and with bipartisan judges. Since I returned home to Baltimore County as the director, I worked diligently to fill the many vacancies that we had here in the office so that we're able to provide a high level of service while conducting 2 types of elections. This will be the first time Maryland is implementing 2 different types of elections. And what I mean by that is all registered voters receive a mail-in ballot application packet, which creates a larger number of absentee or mail-in ballots. To date, we have almost 60,000 ballots applications that we've received, and I expect to obviously to receive more. And then we're also opening all 243 polling places and 11 early voting sites in person. So we're the 2 types of elections is by mail and in person that we're conducting at the same time. There are 6 changes in early voting center locations, and those changes are necessary due to the change in the primary election date, because the community centers were already scheduled for large programs that we weren't able to reschedule. So I found locations at high schools that are within a mile or so of the current early voting center. For example, Honeygo Community Center is not available, so we're going to use Perry Hall High School. And I'm going to do aggressive voter outreach and education to try to eliminate any voter confusion on the early voting centers. All of the election contracts that we have are through the county, and then also the state election contracts have been reviewed to ensure there are no Russian ties. As you may know, we have outgrown our office and warehouse space, and we currently have a satellite warehouse in Dundalk that houses some of our election supplies. And then also we have election equipment and supplies that's being housed at the state warehouse in Glen Burnie. having this equipment at two other locations other than here is very difficult. It's not optimal, and it increases the time and cost of packing and delivering election equipment to our 243 sites. It takes almost 2 weeks to deliver that equipment, and having equipment off-site that we have to have delivered here before we can pack and then have it delivered, again, increases the time and the cost. So we have been working with the accounting administration, and we visited 6 or 7 potential locations throughout the county. And our hope is to have the new location and be in place by April of 2023, which will allow sufficient time to prepare for the 2024 primary and general election. It takes about 15 months to prepare for an election. So that's why we're hoping April of 2023, we can be in the new location. And then finally, I'd like to take this opportunity to thank the County Executive Administrative Officer, Savitra Peoples and Nicole Henderson for their guidance and support over the past few months through the many obstacles and challenges that my office has faced. I am absolutely confident that Baltimore County will be prepared and conduct a successful election. Thank you.
Thank you. And I guess can you pronounce your last name for me?
Yes, sir. Lavoy.
Lavoy. Okay, got it. And I want to, take an opportunity to welcome you back.
Thank you.
As I understand it, you worked for us for some time, and then you lost your mind and went on to Harford County, but you found your mind and came back.
Well, yes, sir. I was Katie Brown's administrator for about 8 years, and I took the opportunity and promotion to learn how to be a director. So I actually went to Cecil County for 2 years as the director, and I am very happy to be back home in Baltimore County as your director. And I never moved, so my heart has been in Baltimore County the entire time.
Okay. Well, we thank you so much. And any questions or comments from the members?
I have a question, Mr. Chair.
Yes. Councilman Crandall?
Thank you. Ms. Lavoy, it's not your first go around for election season, so
That's
and
correct.
we know that your department faced some significant challenges with the delay in getting the redistricting maps. So sounds like you're pretty confident that everything is moving forward as it should be. So that's a good thing. But I do have a specific question for you, maybe 2 questions. So I have a 16-year-old stepdaughter who recently got her license, and she received a voter registration card at 16. And then, so I found that a little odd. I didn't know that the voter registration with MTA or with DMV rather I didn't know that kicked in until you were of voting age. So you can anticipate my question there. And then there was a letter that she recently got from the County Board of Elections. And I don't know what that correspondence was because it wasn't addressed to me and I didn't open it and I forgot to ask her about it. So can you talk to me about what's going on with the Board of Elections and folks that aren't yet of voting age?
Yes, sir. So several years ago, the legislators passed a law that lowered the age to register to vote, although you're not eligible to vote. I can't explain why or anything more than now the law is at 16, you're able to register to vote. I know that I can guess why they did it, and I think it has to do with a lot of students play sports, and now when you play do like rec and park or on leagues like that, you have to have a state ID, and to have a state ID, having a voter card is one of the the forms of ID. But regardless of all of that, the law changed several years ago. So once you turn 16, you are eligible to register to vote, and you are considered an active registrant. However, you are not eligible to actually vote until you are 18 by the general election. So the first thing she received was the voter notification card, which happened when she went to the MDA. Part of their process is registering people to vote. And then the state law also requires us to send a letter to all of those underage voters that says, although you're registered, you're not eligible. So that was the second letter that she received. And we had about a little over 3,000 16 or 17-year-olds that received that correspondence.
Well, that answers that. Thank you so much.
Yeah.
You're very
I have
welcome.
a better understanding, and I can explain it to some people that have been asking me about it. So thank you.
You're welcome.
I'm not 100% sure, but I remember having a similar question, Councilman Crandall, and I think if my memory serves me correct, when you think about the motor voter where people are registering to vote, I think it may have something to do with that 4 years saying that let's get these people now while we have them, because within 4 years, they will be eligible to vote, and they will not, I guess, catch up with them or touch them as it relates to motor voters. I think.
And then
I think you have a point, and I mean, and just keep in mind, it's actually 2 years if you get your license at 16.
may I add something, Mr. Chairman? Also, they lowered the age for election judge service. So in order to serve as an election judge, you have to be a registered voter. So if you were 16 or 17 and prior to the law changing on the age, you couldn't serve as an election judge. But now we can recruit 16 and 17-year-olds for that position because they are registered voters.
Okay. And even though they can't vote, but they are registered voters.
That's correct.
Okay, that's a good angle right there.
Yes.
A lot of them will be out of school, and why not? Make some serious
And
bucks.
we added a flyer, like a recruitment flyer in when we sent the standard state issued letter that says, sorry, you're registered, but you can't vote. However, do you want to earn some extra money for the summer and right before the holidays? So we added that recruitment flyer, and we're reaching out to the high schools with hopes that will help our recruitment efforts.
Ms. Lavoie, you're cutting into our volunteers, but that's okay. Feel free to share that information with us as a council, and I'm sure each and every one of us have a communication system in place in terms of reaching out constituents. I'm sure we all would be happy to help you, especially in the areas where greatest need. Any additional questions or comments from the members?
Mr. Chairman?
Yes, Councilman Marks.
Thank you very much. I seem to recall in the last primary election, we had these terrific lines at all of these early voting sites. What are we doing to make sure that the voters are processed as efficiently as possible? That's my first question. And secondly, I just want to go back to Honeygo, because what was so important at places like Honeygo that they could not accommodate early voting? Was it just summer recreation programs? I mean, I'm worried you're going to have all these people coming to Honeygo for early voting, and despite our best efforts at education, and they're going to be confused where to go.
Yes, sir. I share that. I absolutely share that concern, Councilman Marks. So to address the first question was, I'm sorry, one more time, the lines. So in 2020, I apologize. In 2020, we only opened 42 vote centers, and we had 11 early voting sites, and everybody had to stand 6 feet apart, and we had to sanitized between every voter. So we really can't use the 2020 lines as a comparison for anything because there was nothing normal about the 2020 election. There is talk about opening a 12th early voting center, but there's a significant cost and budget increase for that. But I believe if you go look at the 18 gubernatorial voter turnout, we did not have significant lines. So I am prepared with greeter judges, and I'm going to have an election official staff member from my office at every early voting site. And I'm deploying as much equipment as possible so that there is not a long voter wait time. But I think that we really can't compare what happened in 2020 for a lot of reasons. So I think that we're ready and we're going to be okay. And then to address the second question, which is Honeygo, I worked very closely with the administration and did everything I could to try to keep all of the established early voting centers. And I was told that the large camp programs cannot be canceled. I'm doing what I can now to go back to our established centers in for the general of 2020. I have not gotten confirmation back from Rec and Parks or the administration that I will be able to do that, but I did explain to them that the high schools are not an option and there are no other county buildings that I can use. So I have expressed my concern on voter confusion, especially Randallstown, Honeygo, and the locations that have high turnout. But unfortunately, our hands were tied, and I had to come up with a plan B.
Thank you, and I certainly appreciate your efforts there. Thank you.
Thank you. But to be clear, you mentioned the other locations as having high turnouts. You don't have an issue at Randallstown Community Center, do you?
No, sir. We will be at
Okay.
Randallstown Community Center. Woodlawn, the 6 that have been relocated are Honeygo, Woodlawn, Oregon Ridge, Salers Point. I don't have my list in front of me. Reisterstown Senior Center. Luckily, Reisterstown Senior Center, I was able to secure Franklin High. That's right across the street. So I had a big sign, but that has an arrow pointing turn left, not right, or turn right, not left. So that one's going to be the easiest. I'm going to have signs at all of the other 5 locations letting the voters know where to go. I'm still locating the ballot boxes at those community centers, and I've ordered big A-frame signs next to the ballot box that lets them know where the early voting site has been relocated to. So, and if any, I bought huge feather signs to designate those areas. The information will be included on the specimen ballot. So I really am doing a lot as far as voter education to help spread the word and eliminate people from going to the wrong locations.
Mr. Chairman,
Yes, Councilman Cat.
what about the agricultural center? Is that going to be an early voting location?
No, sir, that was not available either. Oregon Ridge wasn't available. So I have come up with a plan where we're going to have early voting here at the office, at the election office.
And what about the Jacksonville Senior Center?
Jacksonville is available. That one is available.
So we're going to be, okay, so I'll be there with you for 8 days. So
Okay.
feed me.
All right. So I've come up with a pretty good plan. I purchased cones. And all of the vehicles that are parked as you come in our driveway will be relocated and parked somewhere else. All of my staff and election judges, we're going to park up the street and either walk in so that all of the parking will be available for voters. I have an area that I can cone off that will be convenient for the electioneers. And I'm going to have 2 people outside with election vests on, directing traffic. The ballot box is going to go on the other side of where our docks are so that ballot box traffic doesn't interfere with voters coming in. So Amanda and I have spent many hours walking around coming up with a plan. On the inside, voters will be out of the weather coming in, and then vote in the multi-purpose room, and then come out and scan in our big open reception area, and then go right out the door. So the line is gonna, I don't know if anybody remembers when I used to manage Honeygo, we had the line going both ways, and I had judges directing traffic. We're gonna do the same thing here.
Mr. Chair, can I ask, thank you, Mr. Voigt. The Dundalk location, you couldn't get Solars?
No, sir, I couldn't. So we're gonna be at Dundalk High.
Okay, thank you.
You're welcome.
So I do have another question. I was thinking about, in most cases, you're saying when you're moving a early voting location, people can still go to the old location for the drop box, but
Yes,
that's
sir.
not the case up there at Oregon Ridge.
No, I'm gonna have a drop box at Oregon Ridge as well.
Okay, all right, thank you.
Yes, I all of the location, Oregon Ridge is an established location for drop boxes. There's 35 locations. And all of the established early voting centers will have a ballot box. And next to that will be a sign that speaks to the closest early voting site, if it's not that location.
And all of these drop boxes will have some level of security protection, what have you, to make sure that they are safe and secure.
Yes, sir. We have 24/7 video surveillance at all the 35 locations. And then I'm working with the AO to have security patrol during times that the building is closed. So if the building is open, I'll ask the police department to do random checks, but they might not be able to. But when the buildings are closed, that we will have the 24-hour surveillance and security patrol as well. And that contract, I will bring back before you, the council, once I have that in hand for your review and approval. I'm sorry, I didn't hear you.
Okay, thank you very much.
But Mr.
Councilman
Chairman?
Cat? Sure.
Yeah, my wife and I did get the letter from you all to, applying for an absentee ballot. If we don't apply for an absentee ballot, we won't have anything to put in the drop box if we go an early vote, correct?
Yes, that's correct.
So we
If you're
won't,
gonna vote-
so. Go ahead.
No, if you're gonna vote in person and you go to a location that's an established location that I had to relocate, there will be a big sign next to the ballot box and at the entrance of the building that directs you to the closest relocated early voting center.
Right, so I will not be able to use the drop box because I won't have the ballot, correct?
That's correct.
Okay, thank you. I thought that was the case. Okay.
Okay. Thank you very much. Any additional questions or comments from the members? Well,
Mr. Chair, just real quick. Real quick. So will we have or either the council or the public. I'm not sure how that would work. I think we've had a number in the past when issues arise at polling sites that the head election judge can't necessarily fix or something. And there's sort of like I kind of recall like in the past a hotline number, something like that, where if a constituent complains to us as we're out and about, we have the ability to make a phone call to someone on the Board of Elections.
So I will give you my direct line and cell phone. I'm not sure what Katie, I think she divided it between me and a couple other people.
Okay.
But I want to hear from you. So, obviously I can't have my cell phone for the public, but the election judges have a number that they can give election judges or, voters if they have an issue. And they also have an email address. But as far as the council's concerned, please call me directly if there's any issue.
Okay, great. Because there have been issues that are a little like we've had issues of voter harassment in the past. And it was a little beyond the head election judge's capabilities to handle a situation like that. So that's why I bring it up. So thank you, guys.
You're welcome. I will send my my cell phone number and my office desk direct line to you.
Okay,
Great, thank you.
we appreciate that. Any additional questions or comments from the members? Okay. Thank you, Mr. Lavoy, for coming in, and we thank all the members for having a very wonderful afternoon together. And everybody, I guess this is it. Everybody, let me see, we're done for the day, and I guess I'll talk to everybody soon. All right, thank you very much.
Thank you.
All right, bye.
Bye.